enough of saying hi to people. Simply keep tagging people in, okay? This is a very interesting live, and I know all of us have somebody we know that is suffering from diabetes. All of us have somebody we know that has suffered the consequences of the complications of diabetes, be it a diabetic foot, so that an amputation, be it low immunity, be it cancers, okay, be it hypertension, be it kidney failure, and diabetes is just a menace. Like, it's crazy. And the earlier you take this information in, the earlier you sink it in, the better for you, because we can walk around it, we can talk around it and have discussions around diabetes, but if we never open up our third eyes, we will never see light. And the reason why I'm saying that is because look at the number of cases of people who are just dying nowadays of cancer, people who are dying of diabetes and the complication of diabetes. These are people who are on high doses of these medications for diabetes. They are on high doses, but they still experience the complications of diabetes. And diabetic foot ulcers is one of the complications of diabetes. So today you're going to learn something new about the diabetic foot ulcers. And we will question the systems as always. Why do they use honey to dress these wounds? Why do you think this is so necessary? Even though we know after somebody has been cut off or chopped off the leg, complications just get from worse to worst, and they might end up dying of complications of that surgery. So why is it actually advocated for? That is why we are here tonight, okay? So now this is what we're going to talk. And by the way, if you want to have a conversation with us, you can have a conversation with us through the comment section. You can also request to be in on TikTok so that we can get to have that conversation. But stick to the topic of the night, okay? So that we can save time. Now, I was reading about the history of amputations and history of surgeries, and it got so interesting because I saw this that that surgeries and amputations actually started with the Neanderthal man, okay? Those guys who were sharp in the brains and all that, but they lived in these valleys and all that. And during those periods, amputation was actually a punishment. So when you steal, they chop off your hand. And I believe those laws still operate up to now in some countries, that when you steal, they chop off your hand. And then when you're lazy, they chop off your leg. So there were rituals and there were traditional practices that used to just maintain law and order, so that you chop off your leg when you're lazy, so that men do not become lazy in the society, okay? And you become the providers, the ultimate providers. So if you're not doing anything, they chop off your leg. But the interesting part about this time was that when they chop off that leg, of course, you might bleed to death, and they want to prevent you from bleeding to death. So what do? They chop off your leg and then they dip it in seed oils. I. Listen to that. Like, they chop your leg or your hand, and then they're boiling the seed oils. And then they dip your foot inside that boiling seed oil so that they can arrest bleeding. Hey! Hey, hata kama ni punishment. Eh? So you, instead of just, Neanderthal, they had brains, but the brains are not helping as such. So yeah, they dip the legs or the amputated arm into the seed oil so that they arrest bleeding. And then, of course, after that, there came the father of medicine, who was called Hippocrates, of course. And all of us who have gone through a medical school have taken that oath, the Hippocratic oath. Unfortunately, we have taken the Hippocratic oath that defends our patients, that defends the clients, but we never honor that oath. Immediately after graduation, you've raised your hand, you've taken that oath, and it's done. That is the end of it. But the oath talks about autonomy. The oath talks about justice. Justice. I repeat, justice. Justice to who? To the client. It talks about confidentiality. And it talks about doing everything for the sake of the client, who is our patient. But look at us growing ego, arguing on hospital beds who is better. We have a client here we're trying to look after, but we are arguing on hospital beds who is better between an MO and a pharmacist, who is better between a nurse, a registered and an enrolled nurse, who is better between a clinical officer and whoever. In hospital, it's always chaos. It's always the ego. Okay? Ego games are playing in. And that becomes crazy because how did we forget the oath? And the oath talks nowhere, does not state anything to do with money. So when you're taking that oath, we actually understood that this oath has no monetary benefit. So yes, just the same way Mitch is saying, oaths in Kenya mean nothing. Okay, all of us take oaths, but after that oath, we put that Bible down and then we go back to being ourselves. Okay, tunangoja tukiweka Biblia chini tuanze kazi, lakini in real sense after the oath, nothing more, nothing less. We still go back to the same systems that we do. Okay, so ego comes in and we miss the point totally. And now listen to this. After this, after the Neanderthal man who was dipping the amputated feet in seed oils, we moved to Hippocrates. And Hippocrates came up with a very good idea that if somebody has a gangrenous foot, when I say gangrene, I mean it's actually rotting. So there was low supply of oxygen, low supply of nutrients towards the foot, and then the foot started getting got ischemic. Ischemic means no oxygen, and then it started to rot. So when you're getting that gangrenous foot, we cut it off so that we cut you off from the infections that are coming in with the gangrenous foot. That was a brilliant idea, right? But Hippocrates also went another route. So as we are chopping off that gangrenous foot or arm, we will only cut off the part that is actually rotting or the part that's actually gangrenous. But after cutting it down, we will soak that leg in hot water. So we come from seed oil straight into this water, the hot water. So it didn't get any better because people were suffering. And remember that as we go ahead, you realize all these people did not use any anesthetic agent. There was a time people used to get a blow on their heads for them to just go unconscious. And then when the surgeon operates you, by the time you're waking up from that blow, they hit you again and you go into unconsciousness. So it's up to you to remain into that unconscious state for the longest period of time, because if you wake up before the surgery ends, another blow. So there were these guys, the Goliaths those days, who were just specialized in hitting people's heads with the blow so that they can go unconscious. But anyway, that's a story for another day. So at least Hippocrates came in with a new idea that, you see, when you chop off these legs, there'll be a lot of infection. So he was actually very cautious about infections, and he used to wash those wounds or those legs with soap before chopping them off. Okay, so that brought some light here, and I'm taking you through this history because you will see the reason why I'm taking you through this history. There will be a very good relationship here with the church. Okay, so yeah, so now came the third person. After Hippocrates had done this, people still died. People were dying all through, and people got so worried about it. And then somebody who was called Celsus came in with another idea that if you're having a gangrenous foot, we'll not only chop off that part that is rotting, no, because we'll still affect this other part. So what do? If you're having this hand being gangrenous, we will prefer chopping that gangrenous foot or hand off, but near the better surface. Okay, so tusikate tu hii mguu imeoza, we cut including the good foot or the good arm, so that we can actually manage it keenly. But so this one actually documented a lot of things, and his documents were actually very important in the future, because they are actually what we use most of the times to refer to when we're doing most of these procedures. So yes, that was a good one. But fast forward, after this one had this, they came these people called surgeons now, and surgeons were actually coming from the church. They were men of the cloth. So these surgeons came in, and their role was now to perform surgeries, and they were referring to Celsus documentation and all that. Okay, and his idea was, when you chop off the leg, you don't chop off the same way, because remember, we have the flesh, and then we have the skin, the flesh, and then we have the bone. So you chop off that leg or that arm, and then you go deeper and chop off the bone from inside, and then now you pull this skin and you sew it here, so that we stop or arrest the bleeding. That was a brilliant idea. But I want you to remember, as they were doing that, so from the Neanderthal to the Hippocrates to Celsus and now to the surgeons, who are the men of the cloth, all these people never used an anesthetic agent. So you would rely on how fast they perform these surgeries and these amputations. So you can imagine how far we've come from. From this one, then we headed to being beaten, the blows on the head to just go. And then now we have the modern medicine that is actually having a lot of advancements in terms of preventing diseases. We have theaters that are actually sterile, and you cannot find any microorganisms in the theaters. They sterilize the equipment. They use anesthetic agents so there's no pain. And again, they use medications like antibiotics and painkillers after the surgery so that you don't get infections and also you don't get the pain. So we have come a long way. And yes, these amputations in diabetic foot are okay as long as the benefits outweigh the effects, the side effects, right? So yes, when you've gotten yourself to this level, it's just like dialysis. When you've messed up your kidneys so much to an extent that you don't have an option, and then of course dialysis comes in handy, and then of course amputation comes in handy. But you know very well, I have never advocated for amputations and all that. Why? Because I know you can fix yourself, you can actually prevent yourself from getting to the amputated foot or to the diabetic foot ulcers. And as I talked about this, you will get to realize that this is so interesting. It will make sense because we can only reverse diabetes if we want to reverse the complication of diabetes, because diabetic foot is actually a complication of diabetes. So the only option we have is to reverse the diabetes, and then now concurrently we'll reverse the diabetic foot. But most people want the shortcuts. Most people want the shortcuts in losing weight. Most people want the shortcuts in leading healthy. Most people want the shortcuts in everything in life, including making money. Okay? Most people even want shortcuts in religion. You want somebody to read the Bible for you and then, or the Quran for you, and then interpret it in his own understanding to you when you have a brain. That's what I'm talking about. I'm talking about people. I'm actually trying to inspire people who understand what they are doing. People who will actually challenge the healthcare systems. People who will not just walk into the healthcare systems blindly. No, people who have a rough idea of what they're going to do in a hospital, and this will actually empower them to be better people. You don't have to fear your doctor. You need to ask questions because this amputation is going to harm you. The effects are not going to go to the doctor. They're going to go to you directly. Okay? Diabetes medications, as you take them, the side effects are not going to go to the doctor. It is you who is going to suffer the consequences of diabetic treatment. So when you tell me my gyna, my doctor, my diabetologist, I'm like, you are a better person on your own in that kitchen. And I told you that identity and actually truth is very rare in healthcare. Truth is very rare in healthcare. So the moment you start loading that, you start understanding that those people you trust with your own life are actually going to exploit you so much because they sell you the fear. Once you buy the fear, they start exploiting you deeply. They don't care about you, they care about finances. They don't. Very few doctors are doing, very few. And when somebody in healthcare comes out with the truth, they come out as so much controversial, and you start wondering, huyu naye ametoka wapi na hii? They come out as so controversial because most people are in the dark. They have been made blind by the rogue system. They can't even see the light. So when somebody else sees the light, they will always find a reason to pull them into the darkness. That's why when you lose weight, they start telling you, you're depressed. They want you back into the darkness. They can't believe that you're actually living their darkness. So it's up to you to see the light. When you see the light, tell people about the light. So share this information. Don't wait. Believe me, I can't reach everybody. We were in Nairobi until on Saturday, and these 10 or 11 days were not enough because people need assistance. So if you're somewhere you can assist, share that health information. Do not worry about the doctors or the nutritionists or whatever, the registered people coming to attack you. Do not worry about that because it's none of your business. Your business is to ease pain and suffering from God's people. That's how you glorify God. So share that information as much as you can. Go and tell them. Tell people they need it. Tell them. Go and share it. Don't be mean with information. You get it. You come here. You get it for free. You don't share the platforms. You don't share the information. You will die with that information, and that is actually a very selfish move. So share it. Anyway, let's go back to what I was talking about. Now, after these surgeons who are the men of the cloth started doing their thing, and people kept on dying because there was no anesthetic agents, there were no sterile procedures and all that, the Catholic Church the Catholic Church banned amputations. So men of the cloth were surgeons, but the Catholic Church came in and banned amputations and banned these surgeries. On the superficial level, it was a good idea, right? It was a good idea on the superficial level. But just banning the amputations was not enough because it wasn't solving anything. They just banned it because of course, again, I will not go into that. But again, the Catholic Church came in and banned it. So they said our men of cloth, our clergies are not going to do this anymore, and we are banning this, and that is it. And now that is where information about surgeries and information about amputations started to disappear. This book, these documents that were written by Celsus started to disappear, and people started to forgetting about surgeries and amputations, and that is where the problem came in. But anyway, later on, of course, God had a way of just making it come back. So surgeries came back later on, and guess who these surgeries came back through? At that moment in time, there were people. Let me just reveal it. The barbers. These guys who shave. You've seen that guy, the geometric barber who just draws things and then. So those are the guys that actually came in to salvage the situation. So barbers, at that moment in time, they used to use a knife to shave people's hair. Amazing, right? So they shave hair using a knife. And then somebody was seated somewhere and looking at them and thinking, these guys have a lot of experience with the knife. If they have this experience with the knife, why don't we just make them surgeons and they continue with what was happening before? And of course, that's how barbers became surgeons. Now, this is serious. This is true. This is not a joke. So barbers became surgeons because of the experience with the knife. Where? Trust me, no anesthetic agent, no skill, no painkillers, no aseptic techniques. Immediately, these barbers started shaving these people. People died like. Immediately, these new surgeons in the name of barbers started the amputations, including punishments. So you can imagine going to a barber for a haircut and they were told, no, you stole somewhere. This same barber is the one who is supposed to chop off your leg. Okay. But anyway, fast forward, around in the 1440s, sorry. This is about the 14th centuries. That's when they invented the machine for amputations. And that was interesting because this machine was to change the lives of people, because now we are moving from barbers to the machine. But again, no anesthetic agents until we got to the gunpowders, where gunpowders were used to dry the wounds and also help to prevent infections. And then we moved from there to now the first surgery that was done, that was successful, and that surgery was done. And hear this: in the 19th century, they used to do an amputation in less than 1 minute. Yani, you're confirmed to have this bad foot, and in less than 1 minute, somebody has chopped off your leg and has sewed it, and you're good to go. Why? Because they thought the faster you do it, the easier it will be for this guy who is suffering from pain. The one who is being chopped off the leg, the easier for them. So anyway, we are here now. We are here with aseptic techniques. We are here with very good theaters. We are here with sterilized equipments. We are here with antibiotics. We are here with painkillers and anesthetic agents that sometimes, of course, come with side effects. But again, this journey of amputations and this journey of surgeries, we've come a long way. That one we cannot deny. We've come a long way. So back to our day's topic, which is the diabetic foot. I will tell you this. This is one of the complications of diabetes. And I told you, diabetes has two types of complications. One are the microvascular and two are the macrovascular. Anytime I say micro means smaller vessels. And then anytime I say macro, I mean larger vessels. So macrovascular and microvascular. So for the microvascular, I'll give you just a recap. For the microvascular, we have, of course, destruction of small blood vessels and the nerves. So we have peripheral neuropathy, which basically means numbness and that tingling effect and lack of sensation. We also have diabetic nephropathy. Nephro means the cells of the kidneys. So nephropathy, destruction of the kidney cells. And that's how we end up having hypertension. That's how we end up having anemia. That's how we end up in dialysis. And that's how we end up with kidney transplant as a result or a complication of diabetes. That is 2. Number 3, erectile dysfunction in men. Because sugars block the blood flow towards the penis, and for a penis to erect, you need blood flow towards it. It gorges with blood, and then you have a strong erection. Now, when you're blocking blood flow towards the penis, there's no erection. Number 2, sugar destroys nerves. We say it peripheral neuropathy. So nerves that supply the penis, sugar blocks them. Once sugar blocks those nerves, therefore you will end up having a very weak erection. And if you have any, you cannot sustain it for a prolonged period of time. and that's how you start using the Viagra. Okay, so that's how diabetes causes erectile dysfunction. So we have erectile dysfunction, we have peripheral neuropathy, we have nephropathy, diabetic nephropathy, and then, of course, some will experience loss of memory and all that. And then we have this blindness that is called retinopathy. Diabetes, retinopathy. Retina is the eye, okay? And then retinopathy is basically destruction of the eye. So those are the microvascular complications of diabetes. On the other hand, diabetes, actually sugar, and I've explained this in some videos, sugar blocks the larger blood vessels through a mechanism called atherosclerosis. When you block these larger blood vessels, what happens is you end up limiting blood supply to the heart, to the legs, to the brain, and all major organs, even the kidneys. Now, this will mean that these organs start to hurt, they start to die or become ischemic. And that is how we end up getting a heart attack. Now, I really wonder how cholesterol comes in to be blamed for causing heart attacks when we simply know atherosclerosis is a complication of sugars and not cholesterol. So stop blaming cholesterol. So atherosclerosis that will end up leading to peripheral vascular disease. That is blockage of arteries and bigger veins. We have a heart attack. We'll have a stroke. We'll have these amputations coming in as macrovascular. Okay, so all of them are hailing from one source, sugar. And when you talk about sugar, people start saying, oh, you need sugar for survival, oh, you need sugar for energy. You are so brainwashed to think that you need carbohydrates or sugars for energy. And the only reason why you need sugars for energy is because you've exposed your body and your gut to carbohydrates all through. So therefore, your body does not understand any other way of getting energy apart from getting it from sugars, which are carbohydrates. Your body has, today I was talking to a client who apparently was diagnosed with this reproductive health. She's a female. So she was diagnosed with these reproductive health issues. And then, of course, when she went to the doctor and she's been practicing what I've been preaching, she ended up taking a urinalysis test because I recommended that to her. And then they found ketone bodies in urine. They actually wrote ketones plus, 3 positives. And then now the lab technician was so scared about this, so he called the doctor, and the doctor was like, why are you starving? Mark you, this is a woman who has lost weight from 112, she's at 86 kgs. And now the doctor is busy telling her, why are you starving yourself? In fact, after you've done a scan, please come to my office and take some tea plus mandazis. The doctor is 114 kgs. And this is what I want with you guys. Look at your doctor, ask them questions. This lady actually asked the doctor to, to measure his weight. And of course, the guy was reluctant, but again, he decided, because of, he put down the ego and decided to step on the weighing machine. This lady is 86. The doctor is 114 kgs. And the doctor is busy taking tea, the short tea, plus mandazis. And he's telling this lady that she should join him. And then now, of course, the obvious comes in, prescriptions and surgeries. Of course, she was scheduled for a surgery. But I believe that her condition is reversible without having to go to the surgery. I hope that she gets better so that we can actually justify this, and we will. So imagine this lady boldly tells the doctor, I put pim see what a kilo. And then the doctor steps there and almost cracks the weighing scale. 114 kgs, a doctor. Daktari. Hata kama. So now, and you're telling me to take short tea, and you're telling me I'm starving. But this lady had a rough idea of what she was going through, because she was so excited about the results until the doctor was asking, why are you so excited when you're literally starving? Why are you excited and you're punishing your body? The lady is like behind her mind. So she's telling me, I was just telling myself, I wish this guy knew that this is the ketotic stage. Imagine somebody from the general public with no health information talking about ketosis and ketogenesis. The doctor is busy trying to tell you this is starvation and this might lead you to diabetes or to ketoacidosis. And you're there telling the doctor, no way. This is ketogenesis. It's not the same as DKA. It's not the same as ketoacidosis. Imagine that. These are the type of people we want out here. We want to make it so difficult for these people who have ego. We want to make sure that if you take a medication, if you go for any procedure, it is necessary. Imagine that. And that is the dream that I always harbor inside me. I always want to make sure that this gap is so bridged that you have all the information you need. By the time you're going to hospitals, you really need it. Right now, in our hospitals, people are sharing beds in the wards. So our intention is actually to ease the burden on the healthcare systems so that hospitals can only handle emergencies and cases that are totally necessary. Not anybody who has a headache is going to hospital. Not anybody who has this is going to hospital. And this is because we've made sure that the gap between the doctors and the public is so wide that if somebody comes to step in, he's attacked, he's seen as an enemy of the system. So that gap was totally intentional, right? So if you don't have the information, we can easily exploit you. Imagine if you come to me and I'm selling you this fear. Oh, this leg is rotting, we have to chop it off. Oh, you know, you have endometriosis, we have to do a surgery. Oh, you know, you have this bleeding, we have to remove your uterus. And the only solution is removal of the uterus. And I told this lady, doctors and Google, most of doctors and Google are in the same WhatsApp group. Now, if you're here and you are a lady and you know of a condition called adenomyosis, simply go on Google and type treatment for adenomyosis. We talked about it when we were talking about hormonal estrogen dominance, and we knew how to handle them. But just go on Google and type. This is me trying to make you understand that anytime you have a HIV scare and you go to Google and find HIV symptoms, exactly what you're going through is what will come on Google. This is selling you fear because Google is actually controlled by that whatever organization, you know it. Health information cannot be shared there unless these people approve it. And that's why your doctor is always talking about guidelines. And if you Google treatment options for adenomyosis, you will see that the only option for treatment is actually removal of the uterus. You might think I'm lying. Allow me to just take you through this. Treatment, this is Google, of adenomyosis. Now, adenomyosis is basically the uterine wall trying to grow inside the muscular part of the uterus. And they will tell you for free, the treatment is surgery and removal of the uterus. Hey, my friends. So when you become a Google doctor, this is what you'll experience. Yeah? So they'll tell you the only option, yes, the only option is hysterectomy. Hysterectomy means removal of the uterus. Now one day you'll go to heaven or even hell and you'll be asked, where are those organs? Because somebody gave you those organs. Where did you take them to? Why would you remove a uterus just because you have do you cut off the stomach because you have an ulcer? Story for another day. So anyway, a diabetic foot comes in as a combination of both the macrovascular and the microvascular. How does it happen? Remember, on the macrovascular, we are causing atherosclerosis. We are thickening this wall and narrowing the diameter of the blood vessel. As we do that, we limit blood flow towards the leg. We limit immune cells towards the leg. We destroy the nerves that supply the leg. Remember, neuropathy is actually a microvascular. Remember, atherosclerosis and limited blood flow towards the leg is actually a macrovascular. So we are combining macrovascular and microvascular to come up with an effect that is going to lead us to a diabetic foot ulcer. Imagine that. So these people who have been diagnosed with diabetes, sometimes their nerves are so destroyed because they start by feeling that tingling effect, they like needle-like piercings in the legs, sometimes very cold feet, and then it just graduates into no sensations at all. So sugar destroys the nerves totally, and now these people don't even feel any sensations in their legs. And even when they are walking, they don't even feel it. That's the reason why they wear shoes and they get hurt, but they don't notice it. They step on something that pierces their legs and forms this wound, but they don't even feel it. They don't even feel pain. They have too much weight and they're exerting weight on their soles. And these soles are causing frictions. There's a lot of frictions in their soles and they start causing an ulcer. They don't even realize it. So imagine somebody coming to hospitals and already their foot is actually getting infections, but they don't even know it because there's no pain, there's nothing. They are taking a shower, they don't feel the pain. They are wearing shoes, they are just okay. So by the time they are coming in, it's very late. And sometimes it starts like, you see, those people who have fungal infection in the feet, those white surfaces in the feet, when you wear socks that has with filthy legs and you start developing fungal infections in the legs. Remember also fungal infection is actually a complication of diabetes. So they end up having this, and then they just have these wounds. And these wounds, they are not painful, they don't feel anything, and immune cells towards that wound is limited because we are narrowing blood vessels that carry immune cells towards the foot. And now this ulcer starts getting infections. Sepsis comes in. And these people can just pass out or pass away just because of that complication. And they didn't even know it. And therefore, the first therapy for the diabetic foot is to reverse blood sugars. Whether you like it or not, you will have to reverse blood sugars. It is so much criminal to have a parent or an uncle or a relative or a friend who is having diabetes and is suffering from diabetic foot, and they are eating wheat at brown chapati. They are in the wards being served with brown rice in the name of this one has fiber. They are being served with brown bread in the morning, plus tea that has milk. And then you're bringing them fruits, which are basically sugars, that are going to block even more supply of blood towards the legs. So they are there nursing this small wound. It is not healing. Why? Because we keep on constantly feeding diabetes. Constantly feeding diabetes. And when sugar is in blood, it's actually a good substrate for bacterial growth. Bacterial growth, they survive on this substrate. Fungi survive on these sugars in blood. So it is criminal for you to feed a diabetic person, specifically these ones who are going for dialysis, who are going for kidney transplant, who are actually suffering from already this diabetic feet. It is criminal for you to feed them any source of carbohydrates. Now you will say they need energy, but I will tell you burning fat will give them more energy. And if any case, somebody who is diabetic has a lot of energy stored in the fat cells in form of sugar. Sugar is stored as fats in the fat cells. By virtue of them even having high blood sugars that they cannot utilize, why do you find the need to give them more sugars in form of carbohydrates? Why? Imagine that. This is why I tell you, common sense supersedes science. Nature supersedes guidelines. It is criminal. Sometimes just observe nature. Animals are more bright than human beings nowadays. Just look at animals, how they behave. Just look at nature. You will find solutions there. You don't need any science. You don't need science to prove nature. Science gets to a point where nature takes over and science is just defeated totally. But what do you want? You want peer-reviewed papers. Instead of asking how your great-grandfather used to live, you're asking for peer-reviewed papers from the West. Who bewitched you? Hey. So yes, so that's how it starts to happen. Now you have a small prick on the leg. You don't feel the pain because you have nerve damage. That is one. Number two, you cannot ferry immune cells there because for you to heal that wound, you need immune cells towards that wound to start the healing process. But you can't do that. Why? Because there's limited blood flow towards the leg. Even the heart is struggling to pump blood through these narrowing and stiff blood vessels that are actually been stiffened by sugars. Okay? So it's difficult, yes. But by the time you're getting to a gangrenous foot, you've eaten yourself there. And somebody told me that all of us deserve what is happening to us. Hello? All of us deserve what is happening to us. If you're dying from diabetes, if you're dying from cancer, you see the problem is we think we are so good that we can empathize with people. We are not. Nowadays even charity is fake. Charity is for the cameras. And now, because it concerns us, so we think we are so good, we need to take care of these people, we need to be empathetic. The reality is, change starts from within you. Nobody's coming in to change your life. Change has to start from within you. So if you sit there waiting for us to empathize with you, we will just walk. We'll do those diabetic walks with you. But remember, as we are doing that diabetic walk, it is you who will end up having this diabetic foot because that that walk and the shoes that you're wearing are actually going to cause friction and you get a diabetic ulcer. We will not suffer that. We will work to support you because we want to make you feel good and accommodated. And I told you, some of these diabetic uh, organizations are just criminal. Somebody gets a lot of funding and then buys you t-shirts. You wear those t-shirts, he gives you fruits, he gives you juices and energy drinks. As you're doing those walks, you're wearing those t-shirts. The only thing you don't know is he has made a living out of you. And I told you the other day, I saw this guy doing a walk in town for mental health in men. I'm like, mental health in men? What do you mean? Mental health walk. And now you have to you have to make men who are resting deeply. By that, did you know depression is just depressed? Men were built to create. So when you're not creating, you will be depressed. Choose you. Either you create or you rest deeply. So yeah, I was told everything that is happening to you, you deserve it. This is not to disrespect people who have these conditions, but the reality is you have control over everything that is happening to your life. Just lower the ego. Once you lower the ego, you'll see the bigger picture. But the problem is, you have seen all the professors, you have seen all the specialists, you've wasted money, flown all the way to India and back. And now you are at the brink of just going. And even in that problem, in that issue, in that depressed state, you cannot listen to alternative things. You can't. Imagine that. Imagine how ego blocks you from seeing the light. You have done all these things and you've seen the best doctors in the country or even abroad. But I want you to know you cannot buy health. Your health is just in the kitchen. You cannot buy health. If health was easy to buy, we wouldn't have all these billionaires dying. We wouldn't have them dying from complications of sugars. So choose you. Health is your first wealth. So combination of both micro and macro gives you neuropathy, which is destruction of the nerves, gives you atherosclerosis, which is blockage of blood vessels, and that is a sugar problem. And now you have the diabetic ulcer, the foot, and now you cannot heal it, and now it starts to grow, starts to get gangrenous, start to get infections, and now you die from the complication of that. Now look at it this way. You have a very small wound that you can actually easily heal through dietary modifications. Imagine that. Okay, let me just fix this. Good. Amazing. So now you have this small ulcer on the foot that is actually growing and becoming infected. And now we are unable to treat that small wound or that small ulcer, but we want to create a larger wound by chopping off your leg. How do you think you will survive? Hello? So that small wound was not enough. We were unable to treat it. We gave you the medications, they did not work because medications for diabetes are actually going to get you in problems. So we gave you those medications, they did not work. We put you on insulin therapy, it did not work. And now we are unable to treat this wound because we've been treating it with honey, washing it with honey, cleaning it and dressing it every time, but we are not fixing the cause of that wound. We are simply telling you continue eating what caused you diabetes and the foot ulcer, but we will fix this symptom. So we give you antibiotics, nothing is happening. We give you more insulin therapy, nothing is happening. We clean that wound with honey, nothing is happening. But look at you. And now we have to recommend chopping off that leg. Right? So now we create a bigger wound than the smaller wound that we were unable to treat. How do you expect us to treat it? If we are unable to treat that small wound, how are we going to treat this larger wound? I mean, sometimes ask these questions. All about common sense. Imagine that. So now I've chopped off your leg, and now there's a bigger wound. But the diabetes is still there. So even blood flow towards that wound to heal, problems. And most of you had drained your pockets and your insurance just dressing an amputated foot. If you're lucky to come out of that theater, because people pass or die due to complications of diabetes and the complications of just that surgery, the amputation surgery. So now you've come out clean, at least no complications for the surgery. Now you're here, and now we have a bigger wound than we had earlier. So please tell me, ama mimi ndo naona vibaya? Mimi ndo wazimu ama nini? Am I crazy? That I am unable to handle this smaller wound, this small ulcer in your leg. And now I've chopped off your leg, and now you have a bigger wound. So how am I going to manage this larger wound? Yet I am unable to change your situation in terms of diabetes. I have, and by the way, look at it this way. I have already sold you the fear that if I don't chop off this leg, you will end up dying because of gangrene and sepsis. Number two, I've already told you that diabetes is irreversible. So therefore, you cannot blame me. Whatever you're going through is your business, right? I mean, I washed my hands. I told you diabetes is irreversible. So yes, it is irreversible. So how do you expect me to help you? I'll just chop off your leg and let you suffer. Somebody's asking me, this is Pauline, but why are they doing this? It's because we don't ask questions. This is the reason why we need to ask questions. And you see, in a hospital setup, it's actually designed to mislead everybody. You walk into a hospital, you have about 10 minutes in the consultation room. You introduce yourself, and then the doctor asks you, shida iko wapi? So somebody asked me, one day hata wewe utaulizwa na patient, hata wewe daktari shida yako iko wapi? How do you respond? You start getting angry. Daktari, when you did a whole year of psychology to just understand how to deal with patients. But now this is a patient who is here, he's not even psychotic, and you're unable to deal with them, you're getting angry. Why are you getting angry? So unaulizwa shida iko wapi? When you're asked where is the problem, you start saying your problem. So actually, you're not even saying your problem. You're saying the symptoms. When you say the symptoms, what the doctor does is, in his head, he's actually suspecting these are symptoms of this disease. Maybe typhoid, maybe brucellosis, maybe malaria. So let me send them to the lab to do this test to just confirm my doubt. And then when you send to the lab successfully sells you fear through results. You see a lipid function test, you see a cholesterol test, and all the cholesterol are overshooting, and you're like, whoa, and then doctor tells you, see now your cholesterol levels are so high, it's time for you to drop the eggs. And then you drop the eggs and your cholesterol even shoot more higher. And then you go back to the doctor and he tells you, you don't even ask, Daktari, I've dropped the eggs. Why are my cholesterol levels still going up? But you go there and the next thing the doctor is doing is writing you now a prescription to block your liver from making cholesterol. And then you don't ask the doctor what are the side effects of these drugs. Because again, you don't have the time, right? You just come in, I send you to the lab. By the time you're coming from the lab, already the results nowadays, it's always about the system. You come in, the results are already in the computer. So before you even come in, I'm seeing your results there. I just press the number, I see your result there. When I see the results, I'm already writing drugs. So you don't even have time to ask me a question. And then I give you the drugs. Then you go to the pharmacy and you realize these drugs are not there. You become so upset. And this is what you people do. You even demonstrate because there are no drugs in hospitals, instead of demonstrating that the market near you has no foods, natural foods. You are so happy that there's a new supermarket in your area, but you are so upset that there are no drugs in hospitals. You see how you're conditioned to think? So when you start thinking that drugs are the solutions to your bad eating habits and your bad kitchen, that's how we exploit you. That's how we do it. That's how we know you are a slave for a lifetime. And this is the reason why you never see it differently. You're always hoping that every consultation has to end in a prescription. That if a doctor does not write you a prescription, this is not the right doctor. You will change the doctor. You go to another one who is a quack. Will write you a prescription instead of addressing your dietary modifications and lifestyle changes. Some of your diseases, actually most of your diseases, are actually hypochondric. They are in your head. They are in your head. So yes, allow me to market my platforms. Health and Wellness Spot on YouTube. All of you know that. Thank you so much. 87 of you just here watching. We have Health and Wellness Spot on TikTok. That is my major platform. We also have another platform that is Dr. Lewis Muchile, just in case they block this one. And on YouTube, just in case they block this one, the way they were doing, we can actually move to the to hose with Dr. Lewis. So we will never stop preaching. So never ever get worried. Okay. That is one. So YouTube and TikTok, Health and Wellness Spot. There's another platform on Telegram. My friends, if you're missing out on Telegram, simply move to YouTube right now, go and find Health and Wellness Sport, subscribe on that platform and relax. Leave the rest to me. I'll do the rest. I will read these things and bring it to you. So you just go there and subscribe and relax and wait for health content. Move to Telegram and search Health and Wellness Sport. That is a home of healthcare. That is where people who have this information, who have digested it and understand it, are there. You simply go there, ask your question, they answer you. They even refer to you the videos that I have done about this. They will even show you. They even refer you. They will tell you how to actually search things on my Telegram platform. Of course, so you can be there on Telegram, Health and Wellness Sport, on YouTube, Health and Wellness Sport, on TikTok, Health and Wellness Sport. If you're here on TikTok already and you've not followed us, please do the thing. Follow us, okay? You'll never regret that step. Now, we also do online consultations and physical consultations. Most of our physical consultations happen in Nairobi, and we just completed the 1st of August. And they happen at the end or the beginning of the month, and we'll communicate that. But you can always use this contact to reach us out for consultation, 0707 07 47 22. That is our contact, and it's all on my videos on YouTube. It is pinned on all videos on YouTube. And the reason why it's pinned there is because you need it for consultations. Now, do not expect me to address every single my X handle is Dr. Lewis Muchile. At Lewis Muchile, you will actually see the same logo that you see on TikTok, on my platform, on X, okay? Repeat the handle on Telegram, Health and Wellness Sport. Just the same name on Telegram, Health and Wellness Sport. So yes, so that is the contact that I use for my consultation. Allow me to pin it here also. So you can pick that contact and do not call. Simply text on WhatsApp, 0707 07 47 22. Let me pin it here. So yeah, so you can use that that contact for the online and physical consultations in Nairobi. They are always amazing. We have about an hour of deeper conversations. You will understand your disease. You'll understand the medication. You will understand diets. In that conversation, you will understand where your disease came from, and we will help you reverse that disease. Trust me, it is amazing. And you all know of the Testimonial Tuesday. And we'll roll a Testimonial Tuesday next week on Tuesday, so that you can actually see the types of testimonies that people bring in, having tried our things, so that you can get to try yourself. Again, we have the merchandise that we keep on selling. We have the fermented cabbages. We have coffee. And we have the tallow. All these are available at Imenti and in our offices at Lavington. But Imenti, second floor, shop number 6A, you'll find Brian there. He will serve you diligently. I've shared his contacts on my platform, specifically on Telegram. So you can actually use that to get your things. Again, on 15th, that has to be Sunday, right? So yes, on 15th of this month, we always roll weight loss programs, but they alternate 2-month programs and 3-month programs. So this month we are rolling a 2-month programs because the 3-month program already started. So we are rolling a 2-month aggressive program. So you can actually book your slot through the same contact for the weight loss program. Now on my weight loss programs, it's just amazing. We learn a lot. We have these calls, we talk, we have these free consultations. We actually make sure that you get a holistic approach to healthcare and you lose weight secondary to that. We don't just target losing weight. No, we target a holistic approach to healthcare, and then secondary to that, you lose weight. And that is how we intend to do these things. So yes, thank you so much for those of you who are liking the live. Thank you for those of you who are sharing, and those of you who have followed us. That now aside, okay? So yes, just in case you're trying to forget, remember, for you to get to an amputated foot, you must have damaged nerves, which is a sugar problem. You must have poor circulation, which is a sugar problem. And then you must have a weakened immunity, which is a sugar problem. Those are the 3 things that will actually lead you to an amputation room. You will sleep on that amputation table because of those 3 things. 1, nerve damage, diabetic nephropathy. No, neuropathy, neurons. Number 2, blood flow, limited blood flow and circulation. That is atherosclerosis, sugar problems. Number 3, weakened immunity, because sugar holds on to the white blood cells and they are unable to get to where they're supposed to go in time, and that is low immunity. Therefore, infections come in and you cannot be able to fight the infections. and that's how you end up getting a chopped off leg. Okay, there are these things in diabetes that students learn all the time. Something called the intermittent claudication. Intermittent claudication is where these people who have diabetes always suffer muscle cramps in their legs. Okay, you'll see somebody saying, I always have muscle cramps. Now, when you're having constant muscle cramps and you're not actively involved in activity or exercise, simply know you're either pre-diabetic or you're headed to diabetes. Also, these people who have their legs are cracking. In my language, you call it a maka. Have very dry feet and then they start to crack. That's another symptom of diabetes. And you see, when you have that, one, you have a vitamin B12 deficiency, vitamin B7 deficiency, and you have diabetes. So imagine that can actually cause you infection. That can actually start the process of diabetic wound or ulcer in your legs. Okay? Yes, Sonibik, amaka. Amaka is basically cracking of the heels on the legs. So people start asking me, how can I reverse that? And they use that stone to rub until, please, simply fix the diet. The skin will take care of itself. Okay? Yeah. So on intermittent claudication, that muscle cramp all the time, these are the symptoms that you experience and you start noticing that you're getting towards that problem. We call them the 5 P's of intermittent claudication. One is pain. So when you start having pain in the legs, this is the early symptom of you developing the diabetic foot. And number 2, you end up having the pale skin. Number 3, when you try to palpitate those legs, when you try to just hold these legs, they have no pulse. Number 4, we call it paresthesia. Paresthesia basically means tingling, that needle-like piercing in your leg. When sometimes you get hot feet or cold feet, or sometimes you just feel those tingling, those injections in your legs, simply know that that is the symptom of diabetes problems. So you're getting to a problem. And then the last one is paralysis. By the time you're getting to paralysis, that's the time we want to chop off your leg. Because now you cannot feel it, now it's getting gangrenous, and now it's becoming dangerous to you, so it has to be removed. But as I say, if you remove that leg, have you fixed diabetes? Have you? If I chop off your leg, which is coming in as a complication of diabetes, have I removed diabetes? That is food for thought. Yeah, so if I want to remove the foot, the best way to remove or reverse the foot is to reverse diabetes, because the foot came in as a complication. Please, if you understand that this is a complication of diabetes, once you understand that, you're good to go. But before you understand that this is a complication, you might think that this is a condition on its own. So you're busy focused on treating that condition. You chop off the leg, you're using antibiotics, you're dressing the wound. You're failing to focus on what actually caused it, which is diabetes. And that is actually coming from the kitchen. And by the way, diabetes is reversible. I'm not telling you this to sell you hope. I'm telling you this because it's the truth. Diabetes is reversible. If you've been on diabetic medication for more than a year, the problem is you. The problem is you. If you've taken drugs for diabetes and you go back to the doctor and they add you a new drug and they now tell you now have to start insulin therapy, the problem is you. Because by the time you're getting to diabetes, you've eaten yourself so well to fill the fat cells. And of course, when you're eating yourself so well, by the time you're eating yourself so well, we keep telling you this information, we keep reminding you this information. And what do you tell us? Don't worry, I'm enjoying my money. One day we'll all die, okay? You might survive diabetes, but you'll be hit by a bullet. And I'm like, okay, amazing. Only that you didn't know diabetes is a bullet also. So, 3 types of diabetic foot. One is neuropathic. Anytime you hear the word neuro, simply know these are nerves. Neuropathic. The second one, ischemic. The third one, combine the two. Neuro-ischemic. Is it so hard to understand that? That one, neuropathic, you destroy the nerves. Number 2, ischemic. Ischemia means low oxygen. So there's no blood flow towards the leg, there's limited oxygen, and therefore there's no oxygen flow towards the leg, and now the leg starts to die. That is ischemic, ischemia. And then now we have to combine the two, neuro for the nerves and ischemic for ischemia, so neuroischemic. Is that hard to understand? Is it? So don't wait to get to neuroischemic. At least handle the ischemic. Reverse the diabetes, reverse the foot. Heart disease are actually part of this problem. So yes, let's have some conversations with people here on TikTok. Please request to be in so that we can have this conversation with you. And if you're on TikTok, simply like the live. Elizabeth Nyabange, I lost weight and my nerves recovered, felt my footsteps. Imagine that. It is that simple. Now listen, when you're fasting, there's something that is called the BDNF, brain-derived neurotrophic factor. That is a protein that actually rejuvenates the brain and the nerves. So when you start fasting, you get benefits from this. You start rejuvenating your nerves and you start having the numbness disappearing. Again, you start clearing the inflammation in the blood vessels. So atherosclerosis disappears. And now blood flow towards the leg is improved. Imagine that. So not only will you gain from ischemia, you do away with it, you'll also gain from neuropathic. So you'll do away with the aimless nerves, the nerves that are actually failing. So fasting is actually important in people who have diabetes. And I really wonder why people who have diabetes complain about fasting. I cannot fast because if I fast, I'll faint. But you're diabetic. What do you think diabetes is? Diabetes is high glucose, which is high energy in the system. So how will you faint for not eating when you have so much sugar in your system that you need to clear? How will you faint? What will make you faint is your insulin therapy. That insulin injection is the one that is going to take you into hypo. It's not about you fasting, because when you fast, you will clear the glucose in blood and the body will turn to fats to burn more glucose from the fat cells. So you'll not die of fasting or from fasting. But if you fast and then inject insulin, ahera ya fija amando utakimbia barabara. Somebody asked me, what are you drinking? Sorry, this is water. So anyway, let me read through these things that you can actually do when you trying to prevent the occurrence of diabetic foot. Remember, people have diabetic feet and they don't even know it. Okay, so by the time they are coming to seek therapy, it is very late. So this is what you do. One, inspect your legs every single night. Okay, just do it. Be curious. If you have diabetes and you're on drugs for diabetes, start inspecting your legs. Just look at in between your feet, look at the soles and all that. Okay, yeah, you will notice that there's a wound, there's an ulcer here. You will notice it. And then as you do that, people who have very dry legs and all that, simply take warm water, add in some apple cider vinegar and soak your legs in every evening. Do that for about 20 minutes, get them out, and then I need that cup. Oh, Sony Big, these cups are there by the way. You can actually get one. So anyway, so you start having you soak your legs in warm water that has apple cider vinegar, and then you dry with a dry towel. And then invest in quality socks. Most of you wear polyester. Is it polyester or polythene socks that accumulate all the sweat, and now your legs start having problems and infections. So invest in very good cotton socks. And then do not wear shoes that are so fitting. You know these things. They're very minor things that you can do here and there as you fix the kitchen. Okay? So don't wear shoes that are so tight and all that will just cause you the corns that will start the wound. And then lose weight, of course, lose weight. Join our weight loss programs, lose weight. Okay? But most importantly, grounding. Be very careful with grounding. When you have diabetes, be very careful with grounding, because most of the times you might get a prick out there and you'll not even notice it because of the obstruction of the nerves. So be very careful when you're doing the grounding. Okay? Yeah. But it's easy to just fix diabetes. Agnes, people have to unlearn. This is the fear that has been instilled in them by their beloved doctors. Yes, you see, nowadays people even, they personalize a doctor. You'll see people saying, my gyna, my diabetologist. You personalize a doctor. The only thing you don't know is, he's not personalizing you. He's actually personalizing your account. So you're actually making him rich. As you think, my guy na, my guy na. Somebody's asking, fasting plus metformin. Metformin is the only drug for diabetes that cannot take you into hypoglycemia. Okay, it's called a euglycemic agent, so it doesn't take you into hypo. That is the only drug that you can actually take together with fasting. But our essence is to actually make sure that you don't have that prescription. Some of you, your blood sugars have already stabilized, but you're still taking drugs for diabetes. I wonder why. Same to people who have hypertension. You're still taking drugs for hypertension when your blood pressure stabilized long ago. And now you go into hypotension and you start suffering the consequences, the confusion, the sweating, the nervousness, sometimes coma and fainting. Okay? And by the way, this black man, king, and by the way, will sugar effects be the same to a construction worker as to an office worker? Now listen, the body processes sugar the same way in everyone. If you've taken sugar cane, if you've taken popcorn, if you've taken ugali from Posho Mill or from wherever, you're working on a construction site, yes, people hide in the name that those people who are working on a construction site have high metabolic rate. But remember, if you have a functional thyroid, all of you have good metabolism. So anybody who is working on a construction site, I would actually prefer that you do just 2 meals a day. This nonsense of eating 3-5 meals a day just because you work on a mjengo site is the reason why you're always having a flu. You have a lot of energy in your fat cells. Just burn it. Do not create excuses around it, because again, that money that you're earning from a construction site, will it be enough for therapy? If you think it will be enough for therapy, ask people who are going through dialysis. Just ask them. One session is about 10,000 and they do them 3 in a week. That is 30,000. Multiply that by 4. That is 120,000. That is a salary of a civil servant somewhere in the larger office. 120,000 every single month just going for dialysis. If we fast, do we still take insulin? Why would you take insulin when you're fasting? Yet, the reason why you're fasting is to get to insulin sensitivity. The reason why you're taking insulin is because you're eating carbohydrates. You are insensitive to insulin and then you still go ahead and take insulin therapy. Why are you doing that yourself? Sometimes ask your doctor this question. Now, Daktari, diabetes is insulin resistance. So I cannot tolerate insulin. So why are you giving me insulin therapy? Insulin therapy will make you more diabetic because it makes you more fat. It doesn't treat diabetes. It pumps sugar from blood into the already filled fat cells. Can pregnant women fast? Yes, fasting means not eating. It doesn't mean starving. So a pregnant woman, 2 meals a day are enough. Problem is, most pregnant women want to eat everything and then blame it on the baby. And then 3 years after giving birth, they are still blaming on the baby fat. 3 years after you've given birth, you're still telling us it's the baby fat. 3 you've given birth, the child is already 3 years. And you're still telling us, this is baby fat, this is baby fat. At that moment in time, you're saying that in your hand, you're holding chips, the French fries. In this other hand, you're holding a broiler chicken. On your hand, you put the hormonal contraceptives and telling us, this is baby fat, this is baby fat. Baby what? Which baby comes with fat? Solution for cracks between toes, not diabetic. How would you know it's not diabetes? How would you know it's not diabetes, Queen? How? Guilty as charged. Yes. This is baby fat. I had baby fat when I gave birth back to back. I gave birth back to back. And now it has been 5 years of baby fat. 5 years of baby fat. Really? Your child is 5 years and you're still blaming the pregnancy. You change your kitchen. Stop lying, Buana. Stop lying, Buana. This topic is very interesting. You make us wonder what exactly we were doing in school, apart from wasting our parents' money there. No, you did not waste money. Let me tell you, medical schools are designed to actually condition you so that you can condition the entire masses. So you're actually a sample. Okay? You condition the masses, and then the big pharma is happy. And that's why you have guidelines. That's why you have WHO. That's why you have all these things that are actually sponsored by the big pharma. So when you have that, There's no way out. Until you walk out and see the system from the other side, that's when you will see what we actually see. And when you see these things and you start preaching them, everybody will come against you because they are in the dark. But I said it on Telegram. When they come after you because you're preaching health information, do not get upset, because if you get upset, it means you still have the nature of evil. So what do? You forgive them. Once you forgive them, you pray that one day they get to see light. And when they see light, they will preach light. But if you get angry at somebody just because they questioned you, just because they came after you or they attacked you, you are the problem. Nobody has the ability to control your feelings and your emotions. You have the ability to control your emotions. So stay calm. You know what you're doing, right? You understand the information better, right? So why are you getting angry? Forgive them and pray that one day they cross over and they get to see the light. Once they see the light, you are a good person. They will actually regret why they never listened to you earlier. And that's how it works. So when you see all these issues that are coming up, this doctor is picking up this doctor, they are actually arguing. There's even a beef between doctors online. I'm like, which doctors are these? Evil doctors. Evil doctors. Aha, good. Wario Buke. Thank you so much, this gentleman called Selo, for appreciating us. We appreciate you, sir. Wario Buke. Hello, doc. Can persons with ulcer do 24 or more hours of fast? I said it over and over. Fasting requires fast. Ulcers require you to fast. Yes, you can do it. Those MOPC clinics, kazi ni kuangusha sugars na normal saline and insulin 10 units. And then taking the patients to hypo and then resurrecting them again with dextrose. Agnes, you are very right. If you walk into the MOPC clinics in hospitals, what they do is you come in, you have hyperglycemia because you drank tea in the morning with the bread. And guess what they do? They give you an insulin shot. And then they observe you for about 30 minutes. Your sugars have gone down into hypo. And in that hypo, they start panicking. And guess what they do next? They either put some sweets in your mouth or the glucose, the dextrose monohydrate, which is not even glucose. Or they give you soda. You drink that soda, your sugars are going up. The next thing they are doing, they're injecting you another dose of insulin. So they're always playing a game with your system. And when you end up getting a diabetic foot, by the time they're chopping your leg, you're still on high doses of insulin. Ask yourself, how is it possible that I still got the complications of diabetes when I was taking drugs for diabetes? Don't you see that's nonsense? That if you're wise, common sense will dictate that if I'm taking medications to help me heal diabetes, then I'll never have to suffer the consequences or the complications of diabetes. So how is it possible that I'm here taking drugs, high doses of drugs for diabetes, but I still get the complication of diabetes, one of which is the diabetic foot. The other one is the amputation, of course. The other one is dialysis, kidney failure, brain memory loss. Why am I having all these complications when I'm still on high dosages of drugs for diabetes? When you ask that, they start getting upset. Buana, this is Milmo. Buana, you are a blessed man. Thanks for opening up on us, the masses. Thank you so much, Zulu. You deserve it. You deserve it. Okay? And the reason why I do this is because I always pray that you can actually see light from the same window that I'm seeing light. The same God who gives us these visions is the same God who can actually give you the same visions. Imagine you looking at the health window and seeing exactly things the way I see them. Is that not amazing? It is amazing. Imagine all of you who are on these platforms right now. I really pity your doctors. I really pity your doctors because look at it this way. These guys are going to have it rough. Just the same way the government is having it rough with the Gen Zs. These doctors are going to have it rough with people like you. People who have common sense. People who don't have emotions. Estrogen is low because they fast. People who don't have complications, but they can come to hospital just to ask questions. They don't go to hospital for medication. They are coming to hospital to just consult. Yes, hello, thank you, man. To just consult. And you can easily challenge your doctor because you will tell them, I don't need 7 minutes here. I need time to actually ask you questions. And please, before you write that prescription, answer me these questions. What is the problem with cholesterol? Before you give me that soda and then inject me with insulin, please tell me, why am I on high doses of diabetic medications, yet I'm suffering from the diabetic foot ulcer? Why? You have been my doctor for 10 years, right? Why am I still suffering from the same conditions when you know very well that you're putting me on different drugs that act the same way? And that's why sometimes we go deeper and show you how the drugs work, the mode of action of these drugs. Some of you who are in medical schools, you hated pharmacology. You really hated pharmacology, and now it's just dawning on you. Like, hey, now I must understand the mode of actions. It is now dawning on you. And now instead of lowering your ego to have a conversation with us, the only thing you can do is to keep on arguing, keep on seeking validation from people, hoping that one day you will feel right. You have a follower. Yes, you have a good following, but you are empty in the head. Why? Because you've put ego between you and your client. You put ego between you and your client is suffering because of your useless ego. All right, let me just take in about 2 calls and we call it a night. We'll see you again on Wednesday, right? Dennis Gaita. Thank you so much for holding on and being patient here. We appreciate you. It's been just an amazing session between you and us. And you can see how Selo is blessing us with the rules. It's amazing. Thank you so much, Selo. If you're here and the only thing you can do to us is actually like the live. That's the best thing you can do to us. And then subscribe to our channels, because most of you are left behind because, again, you have ego. You're thinking, this one will give up. You're saying we'll give up. We are at 818 videos on YouTube. Imagine that. It's just been a year and a half. 818 videos on YouTube. All of them talking about health content. And you're still there thinking that we will give up. Ole wako. Yes, Dennis.
Yeah, doctor, how are you?
I'm doing fine. How are you?
I'm okay. Mine is just to thank you for the big job you are doing.
I appreciate, bro.
And I've changed since I knew about tallow.
Amazing.
Tallow, I buy 1 kg at 100 bob.
Listen to that. And
you can imagine the seed oil in the supermarket almost 2,000.
Bro, why do people keep telling me that healthy living is expensive?
Not expensive.
I
don't want to take more of your time, but there's one thing I want to congratulate you, and I'm standing saying this about semen retention. I'm the master in that section.
Amazing.
Bye, Doc. Bye.
Bye. Have a good night, sir. Thank you, man. Amazing. I told you, I'm going to raise superhumans. I'm going to raise superhumans. Ladies, be prepared for this type of men. Bure, all of you should start complaining. Hi, Dr. Lewis, no, we cannot handle these men. Please, take back your men. I'm telling you. Here. Right now, you're saying, men are not retaining their semen. Now they are starting. And now you start complaining, these guys have superpowers. No, these guys are bewitched. These guys are on steroids. Ladies, take care. You'll not handle this. And by the way, please, anytime you think about talking about healthy living being expensive, think twice. It's either you're broke or you're just lazy. Because the reality is, I am not telling you to mix the healthy living with the unhealthy living. I'm telling you to substitute. Just get rid of that seed oil and go and purchase tallow and make it. Tallow is so cheap. It is very affordable and it's everywhere. And take advantage now, since your butcherman is still scared of cholesterol. Where I am, I get most of this tallow and they tell me they are afraid of cholesterol. So wanajua ule daktari wa mafuta ndio huyo. So please, take advantage when this moment in time, because there's a time that is coming that people will be they will wake up from their dream, from their sleep. And when they wake up from that sleep, you will lose the tallow. You will be struggling to find tallow. So take that advantage now, so that by that time when it comes, we can fix it at that moment in time. But for now, do what you have to do. Yes, Njeri.
Hello, Doc.
Hello, how are you?
I'm okay, thank you. Just want to say thank you for the good job.
Thank you, and how are you?
I'm good. I've got some issues.
Yeah.
I have some kind of stiffness in my throat every time I wake up in the morning.
Kindly mute your. Is it your television or your YouTube? Just mute it.
I don't have my television on.
Because there's a lot of echo from where you are.
Really? There's not any machine running around me. Maybe I don't know. Do you still hear echoes?
Yes, there's a lot of echo. Kindly log out and come back again, okay?
Okay.
Yeah. Somebody is asking me, how do we store tallow? It is this easy. This is tallow. This is tallow. You just store it in a glass container. You don't have to put it in a refrigerator. You don't have to do anything. Just put it in a glass container and use it for cooking. Okay? This is how you store it. And make sure those plastic containers in your house are actually going out. Get rid of plastic in your house. Good. It is that simple. Just go buy it and use it. God bless you, Doc. You're amazing. You speak the truth. Thank you so much, Elected Curry. I have to. Somebody has to do it anyway. Okay? Somebody has to do it. And the crazy part is that if I don't do it, who will? And the reality is, if you realize what I do, I simply bridge the gap between you and the general the healthcare. Just coming in between to help you understand healthcare. Okay, I believe that's the reason why most doctors are not well. They're not taking it easily or lightly. I just come in, I break down what I understand about healthcare in a language that you can easily understand. And I did that intentionally because I knew when I'm preaching about health information, of course, your gyna, your diabetologist will come and ask me, where are your papers? You are not even a doctor. I'm like, okay, do not even worry if I'm a doctor. At least bring a conversation, okay? Bring that debate. Come on, let's have a conversation. Instead of telling me I'm not a doctor, you are a doctor, right? So bring the conversation. That's what I appreciate. And yes, I forgive you because ego has come in and you think being a doctor is special. It's not. It's not. Somebody's still asking me, why should I get rid of plastics? Where? Where? Ani hapa hata tukahubiri mpaka kesho. Somebody's still asking, why should I get rid of plastics? Hey. But again, I understand that most people here, we have new people, okay? We have new people every other day. So we have to keep on repeating this information. But please, if you're new here, the best thing you can do is take some time, go on my platforms. TikTok has very small videos, and those videos are coming from YouTube. So go to YouTube, search Health and Wellness Sport, sit back, take a pen and a notebook, enjoy the lectures. We do them every Monday, every Wednesday, and every Friday. And then we do a testimonial Tuesday on Tuesdays. Tomorrow we're not doing it, we'll do it next week. So yes, once you do that, you will understand what we are talking about. You will not have to ask these questions, okay? You will become a superhuman being, a health guru, and you will not be exploited by the wicked health systems. Yes, Mbaka, is it Mbaka? Mbaka?
Yeah, Eric Mbaka. Hi, doctor.
Hello, how are you?
Good.
Talk to me, bro.
I'm just impressed with your teachings. You've really enlightened us so much.
Thank you, bro. Thank you, bro.
Such that when we will be facing doctors in future, God willing, they'll be more hungry because we have technology.
Yes, sir, and that's what we want. And actually, we're empowering you to become a better doctor because you are actually a better doctor because you know your kitchen. Your doctor does not know your kitchen.
Yes.
And this is the reason why
there is this question I wanted to ask.
Yes.
As adults, we are just learning to avoid most of carbohydrates because they have sugar.
Yes.
But what about children from age 1, 2, 3? At what age can we avoid these children from taking carbohydrates? Things like.
What is the question again? Kindly repeat the question.
as much as healthy living is concerned, we
Yes.
have children who
Yes.
are just taking like milk, most carbohydrates.
Yes.
At what age can we just cut off these carbohydrates from giving children?
No, you see, the reality is children learn by observation and imitation. Whatever you do, they will do it. And they don't have any problem with cutting off carbohydrates from their diets. They will still survive. So any age, including when you start weaning these children to off breast milk to complementary feeding, that's the time you can actually start weaning them to healthy foods. But you see, most children can tolerate carbohydrates because they are running all over, they are playful. But we are the ones who impose bad eating habits to our children. We make them feed when they don't want to feed. We take them to schools that actually feed them with very bad foods, and then we take them to hospitals to give them antibiotics and antihistamines, which mess up their system generally. So which means if we need to fix our children's guts and their health in general, when we start weaning them off the breast milk to complementary feeding, we start by feeding them on healthy foods that are actually zero carbohydrates. And if we involve the carbohydrates, we can put in the complex carbohydrates, the sweet potatoes, the green bananas, the butternuts, the pumpkins, the arrowroots, the beans, mashed beans. Those are the carbohydrates for children. And then you combine that with soup, with the eggs, with the liver, with the meats, with avocados, and chicken and fish. So these are food that will make sure that your child develops in a healthy way. They grow a very strong immunity, and their brain and intellectual become superb.
Okay, thank you.
You're welcome. Been here a month. This is Abigail. I've been here a month, watched all your videos, and honestly, I've learned and relearned. Blessing dogs. Thank you so much for being here and supporting us. We appreciate you, and we hope that you got what you are looking for, because this is a channel that actually glorifies God by easing pain and suffering from His people. Eve Kilu, Doc, you are officially our family doctor. Amazing. Even my last born knows that the Dr. Lewis has changed mommy's life. A happy listener lost weight from 93 to 80 kgs. Amazing. Keep fixing your health. Keep fixing your health. It is your first wealth. You can make as much money as possible, but one amputation can take that money away just in a snap. And guess what? Your doctor will be smiling to the bank, but on the other side, he will be taking the same money to manage issues with depression. He'll be buying drugs for depression. Let's do 2 more calls and we call it a night. We've done 1 hour and 30 minutes already. So we're going to do Njeri and then Bing Talin, and then we call it a night. Oh, let me do this. So Njeri, Bing Talin, and Joanne. Those are the 3 people we're taking calls from, and then we call it a night. So yeah, it's an amazing, it's actually a pleasure that you guys can actually trust us, and you find what we share very interesting and very informative, and you can actually trust it. Those who are still making noise, we said we forgive them, and then we pray that one day they get to see the light, right? Amazing. Jerry has disappeared, so we'll go straight to Bing Talin. And then we call it a night. So if I've not done justice to this diabetic foot, then I don't deserve to be here. I've done several lives on diabetic foot, but this one I was intentionally doing differently because I wanted to make sure that it sinks in, and I'm glad that we've done that. Okay? So if you're on TikTok and you've never subscribed on my YouTube channel, please go there and make us grow. Health and Wellness Sport is my channel on TikTok, on Telegram, and on YouTube. Also, on Facebook, I exist as Lewis Muchile.
On TikTok?
Yes, Bing Talin.
Never subscribe on my YouTube channel, please go there and make us grow. Health and Wellness Sport is my...
Oh, Bing Talin, you are listening to... Oh. Simply mute that and then talk to us. Talin, are you there? Talin is experiencing network problems. So yeah, so let's do Joan Chantel. Agnes Opoku. Hello, Doc. Please, what is tallow? Tallow is the beef fat. That fat that comes from beef. Simply go to the butchery and tell them to give you the beef fat. And then put it on a sufuria and put low heat. It will render the fat. That is what we call tallow. Comment on coconut oil. I have an access to eat. Anyone interested? Yes, coconut oil is a saturated fat. We use it. Actually, it's the only saturated fat that is not an animal fat that I recommend. Apart from extra virgin olive oil, which is not supposed to be used for deep fry, it's supposed to be used for only top dressing. That's what we agreed. Yes, Joanne.
Hello, Doc. How are you?
I'm doing fine. How are you?
Fine, thank you.
Yes, talk to me.
Doc, 31 weeks pregnant.
31.
Yeah, 31 weeks pregnant, and my pressure has been going up. And I just needed your advice because my gynecologist has put me into a drug called Nefin to manage the pressure.
Guys, did you hear that? My gynecologist. Why do people personalize doctors? Just say the gyna put me on this. Now listen. One, what is your body weight?
88.
88 kg, and your gyna did not see any problem with that. Now listen, this is the reality. You're at 31 weeks, there's nothing we can reverse. You still use that nifedipine to bring down your blood pressures. But do this. What is your cooking oil?
The normal cooking oil, fresh fry.
Okay. Do you consume wheat products?
No, at the moment, no.
How about milk?
No.
How about fruits?
Yeah, I take fruits, mangoes and oranges.
How about sugar?
No.
So why don't you drop that fresh fry? Why don't you drop the fruits except avocado? Why don't you change the cooking oil to ghee or coconut oil? And then, what are your carbohydrate sources? Do you eat ugali and rice?
At the moment?
Yes or no?
No.
So what do you eat as carbohydrates? Joanne? Oh. Now, somebody tell Joanne to go on my YouTube channel and just find diets for pregnant women. Please type in the comment section. You should just go on my YouTube channel and just search diets for pregnant women, health and wellness sport. She will see all that she needs there. I have put it there. Doc, talk about rice water that is all over the social media. Run. See, masses don't see what you see. Simply understand this. The entire masses are in the dark. They are blinded. They are so blind. They will follow anything that comes. They will follow the wave. They'll follow the media. They'll follow social media. They'll follow all that. Go against what the masses are doing. Right now, they are going for the vaccines. Go against that. Right now, they are vaccinating your livestock. Go against that. Simply do exactly what is against the guidelines. Rice water. Why do you need rice water to lose weight? You can lose weight by just eating healthy. Don't allow those people to lie to you. And I've seen most people doing it, and they're losing weight. But what they don't know is it's not even sustainable. That's the reality. We are looking at sustainability. We are not looking at you losing weight. We are looking at you gaining or losing healthy weight secondary to leading a healthy life. There's no shortcut about it. Ozempic is not a shortcut. Rice water is not a shortcut. I don't know, concoctions are not a shortcut. Colon cleanser is not a shortcut. Do not go for shortcuts. Use the long route. It is very sustainable. Okay, good guys. So now I have to go. Thank you so much for attending this live. In case you need a consultation with us, simply use that contact that we've pinned, 0707 07 47 22. Book an appointment with us. We'll give you a whole hour of conversations. You'll enjoy it. Also, remember to subscribe to our platforms. Follow me on TikTok. Subscribe on my health and wellness channel, health and wellness sport channel on YouTube and on Telegram. You will never miss out on health information that is very beneficial to you. Thank you so much for being patient and staying here with me for all this live. We will see you again on Wednesday, the same time, and we will see what we can talk about. May God keep you safe. And again, keep preaching, keep spreading the gospel because you are a better doctor than we are. Thank you, and have a good night.